ओके, तो हमारा पहला सिनेरियो कंफ्यूजन से है विद यूटीआई. Yes, I will talk in English. Sometime I forget that there are other students as well, because I take OET classes as well, and that's purely based in Pakistan. So I have habitual of speaking in Urdu, in my language. I'm sorry, and thanks for reminding me. Okay, so the first scenario is today we will spending most of our time with the headache scenarios and with backache scenarios. However, we will give a quick review towards the confusion scenario, because they are, first of all, they are easy. Secondly, you have already done that, and in the last lecture, actually it was the part of the last lecture. However, we could not cover that, so we will be doing that in a very quick way. You are FY in emergency department, because it's always important that where you are. So whenever you make the habit, where you have, which thing should come in your mind initially, where you are. Before everything, where you are. In A&E, you are in GP, you are in orthopedic, where you are, this is important. Okay, you are FY in A&E, emergency department, and 70-year-old presented with confusion. Talk to the wife, address her concern. Okay, so this is the patient information has given below. This will not be given to you in the exam. You will be given the information. This is the examiner prompt. So we have put this information to let you know that what type of scenario it is, that you should know about the whole story. That's why we have put this information below. Otherwise, this will not going to come in the real examination. In the real examination, Owen address his concern. That's it. Your scenario is done. Patient information. Mr. You are Mr. Ian I's wife. Okay. Today you come to the hospital with your husband who is confused. Okay. 24 hours ago, you came to the hospital 24 hours ago, and he was prescribed with trimethoprim oral tablets. Yesterday, you were able to have normal conversation with your husband. However, today he's confused. Okay. Even though he was given medication, he is getting worse. You are not happy with the situation. Okay. This is important in prompt, that she's not happy with the situation. So this is the medicine scenario as well. This has become the counseling scenario as well, because she's not happy with the scenario, and she will tell you that I'm not happy with this. Okay. So you should keep in mind, and you should address her concern as well. So first of all, you will be starting such kind of scenario whenever there is a guardian, parent, anybody with, and he wants or she wants to talk regarding her person. You need to have certain things in your mind. First of all, check the relation, how you are related to Miss Patricia. How are you related to Miss Patricia? You need to ask this after doing the grips and introduction, and you will be starting with how you are related to Miss Patricia. And then you will be, however, in certain scenarios, there is not a written consent over there. So you will not be talking, because here the patient is confused. Of course, you have to take that without having the consent. However, in certain scenario, not this one, there comes the scenario that the patient's guardian or parents or daughter, anybody along with that want to ask you questions. However, you cannot tell, because you cannot open the confidentiality, but here you can, because the patient is confused. The patient cannot give the consent. So you will assume that the consent is taken. Okay. Just confirm the relationship. It is important to confirm the relationship. How you will confirm how you are related to Miss Patricia. Okay. In this way. Okay. Then according to our approach, we will be asking for 4 Qs. What last time, 24 hours ago, when she was brought in, what symptoms she was having, what treatment was given, what investigations were done, and what she was told regarding her condition. Okay, these 4 questions are always mandatory in a follow-up question. In a follow-up station, always this is a follow-up, because 24 hours it was there. Okay, now I'm going to talk about the confusion scenario. What comes in your mind? What comes in your mind when I ask about the confusion? Okay, give the DD give the quick DDs. What should be in your mind whenever there is a confusion? Just be quick. Delirium, yeah. Alcohol intake, yeah. Old age. Hypoglycemia, good, great. Okay. Very nice, very nice. Everything it can be actually. There are a lot of things. This is a very broad spectrum scenario. So what you should do in this scenario, I must ask sepsis exactly. I must ask, you should do systemic inquiry. What is systemic inquiry? Have you people done PAMU in the child when there was um, uh, uh, PEDS scenario we were discussing? PAMU. This is similar like that. Whenever there is a confusion scenario, broad spectrum, always do what? Sepsis screening. Always do PAMU. Ask about small question about everything. Okay. Medicine side effect. Okay, that's great. So again, infection. First of all, you will be starting with the infection. Which infection? UTI. You will be asking question regarding the UTI. You will be asking the question regarding the meningitis. You will be asking question regarding the pneumonia. How will you start? What question you can ask? You can ask. He was having any cough, any fever. That straight away question. Fever, cough, any problem with urination, any problem with poo, any shyness with the light, any neck stiffness. These are the direct infection questions. Infection scenario, always ask these first.
वो गोली सस्ते लिखी खड़ी तोरी 2.5 mg जेरे वेले कहीं वेले किडी भी तोरा छाती दर्द पे वने टूरन नाल ओहे गोली जबान ते रखनी है.
Okay, I have already done. Please mute your mic, because then otherwise there is a like disruption. Always keep your mic mute until you want to ask something, then open your mic and we can conversate, no problem with that. Okay, so first of all, rule out the infection, then trauma. Always ask about the head injury. In any confusion scenario, always ask about any pain scenario, always ask about the trauma. For example, headache. We are in whole of today's scenario, you should ask the trauma question, because it can be trauma. Okay, ask about the trauma. Have you received any trauma recently? Then dementia. Is he usually confused? Is he being forgetful these days? Okay, so you will be asking dementia question. You will be asking the hyponatremia question. You will not ask anything like that. Why? Because this is only you can rule out in the you can ask one or two questions, like any confusion is confusion, any irritability, one or two questions you can ask any irritability, but that's a non-specific question you can ask. Then these are sufficient questions to rule out any confusion scenario. These are sufficient, because infection you will be asking 3 to 4 questions, then head trauma, then dementia, then hyponatremia. Okay, these are sufficient questions you need to ask in confusion scenario. After that, you will be doing PMA Holy Family Dysautoly. PMA Holy Family Dysautoly. What is important in this? You will be asking about the liver disease specifically. Why? Because of the encephalopathy. Asking about the tattooing, any needle sharing, you should ask here. For example, needle sharing, if it is like young person, otherwise you need not to ask. You need not to ask about the tattooing in the old age patient. But you should ask about the liver disease. Okay. In PMA Holy Family, when you ask about, do you have any long-term medical condition? Does she has a long-term medical condition, any condition like liver disease, chronic liver disease, any hepatitis B, C, anything like that, okay? And colic disease. Ask about the medications, especially oxybutynin. There is a scenario, oxybutynin, that is a confusion scenario. That was in my exam. I think that is placed over here. I don't think so that is here. We have placed that scenario in, but that was in my exam. This scenario was there. The person who was playing football and then he just fell down, and he on the next day he came, but he was all right. Actually, that was with the he got developed confusion because of the oxybutynin. He was taking this. Alhamdulillah, I got 9 marks on this. And however, I was not sure that this scenario was due to oxybutynin, because I just followed the approach and got 9 out of 12. Then always ask about excessive alcohol and alcohol withdrawal. If the person is taking alcohol, ask about how much. Ask about, have you been taking before? Have you left taking anything? You should ask all these questions in PMA Holy Family. PMA Holy Family Dysautoly. Today I repeated for you so that you kept on remembering. First thing, P for past medical history. M, medical history, any long-term medical condition. M for medication, any over-the-counter medication. A for allergy. HO for hospital admission or operation. F, family. family for family history. Okay. Then desatoli, D for diet. How is your diet? E for exercise, S for sleep, S for stress, S for smoking, A for alcohol intake. So complete your desatoli, and TOLI, T for travel history if it is important. Occupational history is always important. And who do you live with? L for live with is always important. And I, the impact of this, of course, you are not going to ask this, all of these questions, only the relevant question. You will not ask the travel history. You will not ask about the impact of this disease on the life, because that's not, that is the acute symptom, not the chronic symptom. If there is a chronic symptom, you will be asking the question, what is the impact on your life? Okay. So this is how we are dealing with confusion. Okay. Then come OET observation. In observation, what is important over here? You will say GCS. I'm going to do the observation. Okay, you know what is observation. Then I'm going to do the general physical examination and your GCS. I will calculate your GCS. I will calculate his GCS. Why? Most probably examiner will not say anything. Maybe he will say, okay, his GCS is 18, sorry, 13. Neurological examination, and in the confusion examination, you need to do the AMTS, that is abbreviation mental test scoring. This is the 10 question. In the other scenario, you just give a read to this, you remember this, but they are not going to ask you to do that, but you need to mention that, because it's the confusion scenario. It can be the memory problems, so you need to say that. So two things are quite important that are different from any other scenario. One is GCS, the second is AMTS, abbreviation mental test scoring. That is the 10 question. You just check his memory and everything. I'm going to give. Okay. Now comes towards this management. Look, when we have taken the history, we have found that the confusion is due to the UTI, and actually she is going through the sepsis. I don't know. It is she. Then whenever there is a sepsis, there comes in your mind, there should be one mnemonic: sepsis 6, sepsis 6, always. We have already done that, sepsis 6. What is that? Give 3, take 3. But we will make our own arrangement. We will not be saying that we are going to do the sepsis, but it is for you to keep in your mind whenever there is a scenario in which there is like you are having suspicion of, and you diagnose with the sepsis, because here it is the sepsis. So what you are going to do, you are going to admit the patient, explain that. From what you have told me, it seems like you are having, his symptoms are due to be urinary tract infection. Because of the infection, he become confused. This is your diagnosis. Then what is your decision? You will be managing under your medical team, routine blood test, bladder scan, antibiotic, and antibiotic will be given through the veins, screen for sepsis, and urinary test. Okay, this urinary test should have been done over here as well, not here, because this is bedside test. So I suppose this should have been done over here in OET, not here, because this is very common test and you need to do on the bedside. So always mention that here where you are mentioning these tests: CBC, ABGs, chest X-ray. We have mentioned the LFTs, RFTs, and urine test as well over there. Okay. Okay, this is, you have taken the decision. Then comes the patient concern. Always the patient concerns are important. Always the person is sitting on the other side, his concern is important. Why he become confused? You will be explaining that because he's the elderly and due to, this is very normal question. You can answer just by the reading that. Why you send him home when you knew become more confused? Okay, this is the question which is going to make you confused if you do not know the answer regarding this question. So doctor must have expected him to show some improvement, but unfortunately antibiotics did not help because it was oral antibiotic. So it was the unfortunate situation. You have to sympathize here. Okay, I'm sorry that this has happened with her, but it was not what we had expected at the time. That's why we send her home. So you will be saying, you will be apologizing in apologizing attitude, because this question is quite, in this scenario, this question is like very much important. This should be highlighted in your notes, this question, because on this question, you will be answering the straight away. You will not be knowing the answer. You will be like stumbling, and this will reduce your marks. So all in this scenario, everything is easy. Answering this question is difficult. So you must know how to deal with such situation. Okay. In the next time, if the situation occurs in another scenario, you must be doing in the same way. Okay. In apologizing, in empathetic way, just learn this by heart. Okay. This is very much important what I'm telling you, because most of the time we translate in our mind. We just have a thought coming in our mind in our own language, then we are translating and we cannot like throw the idea, we cannot convey the idea. And what need to be done in such a situation where the long answers and you have to empathize, you need to learn these phrases. What phrases? I'm sorry, I apologize, you are not happy. So you need to learn these phrases. I'm reiterating this because I know that this is important. So you need to learn how to deal such situations, because half of the exam is only these things. Okay, because they want you to be a safe doctor and how you can handle the situations. Okay, then there is other scenario with the confusion due to hyponatremia. FY2 80-year-old brought in the hospital with confusion, COPD, speaking to the doctor. Again, I'm not going to repeat anything. You can do everything we have already talked about. You will be doing all these things together. You will be talking about infection. You will be talking about everything. And keep in mind, in confusion scenario, if you do not speak while doing OET, in the OET, when the OET mnemonic, you will not say, I'm going to do the urea and electrolyte. They will not give you. They will not give you the results. So you need to speak in a confusion scenario very specifically. Okay, I want to do, we need to tell the other things as well, but this thing we can never forget in the confusion scenario, because it can be due to hyponatremia, it can be due to anything. So we cannot forget this to ask about, because COPD patient is the COPD patient and we cannot assume anything. So we have to ask everything. Everything is same. We have talked already about. I'm not going to talk about anything about that because the history is the same. Okay, let talk a bit about its information. Father was confused today. He was fine yesterday. He lives alone. Because he lives alone, now it is your concern. What? Who do you live with? Where it is important, who do you live with? You visit him every day. He does not have any medical condition apart from COPD. That's it. Okay. So what you will say in the OET observation, GCS, neurological examination, and you will be saying urine dipstick, because it can be due to UTI. Cannot miss the UTI, cannot miss the urea and electrolyte. These two things are like very much important. In these two scenarios, UTI, urine dipstick is important, and urea and electrolyte is quite important. Okay, examiner will not ask you to do the GCS, because I have already taught you how to do the GCS, but they will not ask you to do the GCS. They will give you the finding. It's 14/15. Okay, explain. It is it is not very clear. Okay, if the things are not very clear, you should say, and you should never assume that it is only because of hyponatremia. Because we will be asking all these questions, then having the hyponatremia, we will be able to say it look like it is due to hyponatremia. Okay, so we will be asking all these questions we have already talked about, and then we will be explaining the thing. It is not very clear why your father is confused. In elderly people, you will become confused either with an infection like urinary tract infection, confused. But we checked it. It is not. You will say that because you have done the urine dipstick and there is nothing in urine dipstick. Okay. It seems like it's not due to infection. So they will give you then the finding. Okay, the urea and they will give you these findings. These are the findings. Examiner will give you the blood test. HB is this 9.4, and range is below the 11. Sodium is 125, so it is moderate one. Creatinine is this, so there must be going some renal injury. So now, after having these reading in front of you, what you will explain? Maybe examiner will give this when you say this. I will be doing these RFTs. Look, when you say I'm doing RFTs, I'm going to do like urea and electrolyte, and these findings will be there. Okay, CBC is always we ask about the CBC. Then you will. I have just seen your blood test, which shows that your blood is quite low. Never forget to say this as well, because blood is HB is low as well. You need to explain that to the patient. HB is low, your creatinine is high, and your sodium is low. It seems like there is some insult with your kidney function, because all these findings are consistent with some kidney problem. So what will be your management? You will be admitted under the medical team and correct the sodium first, because that is an acute. Because of that, this has become confused. Otherwise, you will be involving your senior as well, and at this level, and then maybe you will be required to need the erythropoietin. Just mention that. But your work is an initial management. What is initial management? Immediately admit the patient, because it is now moderate and it's confused. Is with the symptom and moderate, you need to admit the patient and you need to correct with the help of your seniors. And after, you will be giving erythropoietin. But for that, it should be your senior, not you. Confusion due to, in fact, you have admitted that you have talked to the patient. You will be going some specialized test. You will see for and what actually cause of his renal, like his raised creatinine. In this scenario, you will be talking all these things to the patient. I could not, because this is what is the category of hyponatremia. Just for your like study purpose, you can see that again and again, so that hyponatremia, we have already discussed hyponatremia scenario in last lecture. Hyponatremia, which was like with the tiredness, but it is with the confusion. Confusion due to infective exacerbation of COPD. This is another scenario. Similarly, in emergency, 62-year-old man brought to the hospital with confusion. Patient info: he is carrying a letter of GP. Thank you for seeing. Who was brought in by neighbors, confused, COPD and asthma. And on examination, these scenarios will be given when you will be no, this is okay, this is with the notes are given, and you will be like studying from here. And other patient info: coughing for few days. This is from other patient info. That means this is what is written on the GP letter. These all these vitals. Other info: when you will be asking to somebody with the patient, you will be asking these questions: coughing for the few days, no chest pain, patient is confused. Most of the time patient tell you, I don't know, I don't remember anything, used to smoke. And you will be asking all these questions. If it is alone and is asking from the patient, you need to ask from the patient. And if somebody is with the patient, you will be asking from them. Okay, there is nothing different in this scenario. This is again similar confusion scenario. You will be asking all these questions together. Nothing is changed again. And in the management, the condition is due to infective exacerbation of COPD. You have a chest infection and your COPD is getting worsened. This is what your diagnosis is. You will be telling the patient. Then what will be your decision? Again, your decision will be, you will be like, this is in the emergency. You will admit the patient and call for the medical team. You will admit the patient under medical team. This means it's not we will refer to the medical team. No, you will admit the patient under the medical team and you will call them, send for the call, and you will be sending for more investigations, and you will be giving the patient IV antibiotic, nebulization, hydrocorticosterone. These are the basically your treatment, initial treatment. Your decision: what is your decision? We will admit and we will be giving this, and then we will be involving the senior, because we will be dealing with the emergency by ourselves. What is that? We will be giving IV antibiotic, nebulization, IV hydrocorticosterone. Okay, then you will be contacting for like you need to contact with the GP, or you speak to the doctor over the telephone. There can be anything. They would have asked you. You can contact them and you will say that for the further information, I will contact them. Okay. Any question regarding the confusion scenario? Because these are the easy and we have already studied them in the last scenario. It was the similar scenario, nothing much changed. If you want to ask any question, we can discuss on it. Then we will be moving towards our other scenario, that is the backache and the headache. Anything you want to ask? Otherwise, I'm going to move towards the next section.
If the patient does not give any history, like just like this scenario, and the patient is confused and is not very cooperative, and we get all the information from the GP notes,